Here we're going to talk about some hip 90-90 modifications. So the classic hip 90-90, feet are on the wall, 90-degree angle at the hip, 90-degree angle at the knee. And we're taking deep breaths into the abdomen, trying to get that 360-degree expansion, where we see the lower stomach, the ribs move as the diaphragm pulls down. We feel pressure into the low back as air expands into the lumbar spine and out the sides. That cylinder effect of breathing. And with these modifications, none of that changes. We just set up our hips and our pelvis and our arms in a way that maybe encourages air to go into slightly different locations. So the first one we're going to look at is a right arm reach. Hip 90-90 with the right arm reach, I'm basically taking that right arm and I'm creating rotation. By lifting that arm, it creates a small amount of rotation. When I'm doing the right arm reach, because I've created that rotation, my big focus here is to breathe into the back of the rib wall on the right side. So we're just trying to, think about the area between your shoulder blades. As you inhale, try to think about inflating that area right underneath that right shoulder blade, if you will. And that's really to look at scenarios where the right shoulder is a little bit lower than the left. If I can get that right side to rotate and inflate, it should help unrotate that to take that appearance of a right shoulder down effect. So that's our hip 90-90 with the right arm reach. The next one that we're going to look at is hip 90-90 with hip internal rotation. So when we go into internal rotation of the pelvis, the initial tendency is for the pelvis to anteriorly pelvic tilt. So when I'm in this 90-90 position, I'm already set up in a little bit of a posterior tilt, so we're kind of getting this conflicting battle of which way does it want to go. And what we're trying to accomplish here is to create slightly more true femur on socket, femur on acetabulum, true internal rotation through the femur, and still maintain a posterior tilt in the pelvis. So I want you to try to maintain that same posterior tilt position of the pelvis, try to keep that consistent while you internally rotate the hip, and we'll see how far we can kind of increase that hip internal rotation range of motion with a rounded or a flexed pelvis, posterior tilted pelvis, if you will. So again, we're just looking at little different biases in the hip and the shoulder, but still keeping that same principle of a 360-degree inhalation and then a full exhalation, allowing all that air to escape out.